We are back to our show in Good Morning Kuwait. We are trying best to highlight the update with someone with very important events and campaigns organized in the state of Kuwait, Sarah.
Exactly. Sight is a highly developed sense. It is important for learning using tools and devices. Vision is essential for maintaining optimal performance and principal sensory pathway of learning.
For all, vision is the vital tool for functioning in daily activities, for the perceiving beauty and also achieving personal fulfillment. And we know more about the vision plays in a major role in our children's social and even also physical development, Sarah.
Therefore, Kuwait University and the Ministry of Health and the private sector collaborated in an amazing campaign, Protect Our Children's Vision, that took place at the Avenue Mall from the 21st to the 26th of March.
To talk about more about the importance of the healthy vision of the children and to protect our children vision campaign, Sarah, this is very important campaign.
It is very important. With us in the studio, Dr. Manal Mansour. She is a consultant ophthalmologist, assistant professor and faculty of medicine, and also the president of Women in the Ophthalmology, Middle East Africa Council of the Ophthalmology, and Mr. Ali Banddor, founder of the CEO of the iZone. Well, so dear viewers, so let's welcome our guests. So hello and good morning, doctors.
Good morning.
Good morning. Thank you for having us.
You're most welcome and thank you for joining us this morning. We are very delighted. We already been in this campaign, by the way. We already have a tour. We already saw the thing. I was very proud and very honored to see how much the pioneers for the major ophthalmology are doing there and giving the consultation for everyone. Dr. Manal, I see everyone know you for a long time. So we already speak in the off-air, but people need to know you more, especially people who's watching us through the KTV2. Share it about yourself.
Absolutely. Well, to start with, thank you very much for hosting us this morning in this beautiful program. Basically, I'm a consultant ophthalmologist. I'm an eye specialist. I'm an academic staff member in the Faculty of Medicine in Kuwait University, and I've been privileged by being elected to be the president of Women in Ophthalmology at the Middle East Africa Council of Ophthalmology. This is basically a supranational organization having 34 countries members in it. Our event over the past, over the weekend started on the 24th, lasted for 3 days. We were there at the avenues from 10 to 10 with a wonderful group of volunteers from the private sector, the governmental sector, a non-for-profit sector organized by iZone organization. It was such a privileged a situation where you feel that you are sharing part of your expertise and actually life mission in trying to prevent problems before they actually happen. This is the mission.
This is the mission, and we are very proud and happy you are both with us here in the studio, Sarah. This is like the campaign about how to protect the vision of our children.
Exactly. It is really an interesting campaign, as Dr. Manal said. So, Mr. Ali, can you tell us more about that campaign that took place like 3 days from 10 to 10?
Yes, that campaign was organized actually to bring awareness to kids, parents, and society to make sure that this sector of society, they should be aware of using their eyes and have their eyes checked regularly.
Yes.
And to also tell them tips how to use their eyes in a very healthy way. So mainly we wanted this to reach majority of people, and thankfully we had really a great amount of people visiting the booth and having their eyes checked, and awareness was spreaded successfully.
That's great. So they have their eyes checked actually in the campaign.
We actually managed to test 796 persons, to be specific.
Yes.
Huge number.
796.
For 3 days?
For 3 days.
Nice.
12 hours, 3 days. Actually, the estimates were around 200 to 250 a day. That was our expectation. So we've exceeded the expectation.
So about like more than 700%, they will get their eyes checked.
Yes.
So this was your goal in the campaign?
Well, it was. I mean, this is a joint, vision. Initially, the program. Let me say that we wanted it to be a program rather than just a campaign. The campaign for 3 days is an opportunity for us to be there out in the community, especially after COVID and after the restrictions and how the virtual online education affected, everybody's vision.
Yes.
But mainly, especially children using tablets and iPads and mobiles and computer screens and all that. So we really wanted to, to initiate this program by having this campaign.
Amazing. So this is like the main goals for the campaign, Sarah.
Which is a really lovely goal.
Lovely campaign.
That's amazing. Mr. Ali, you choose venue malls,
Yes.
exactly. So why you actually chose such a place, like this big mall actually in Kuwait?
Yes, we have 2 reasons for that. Firstly, we thought that kids would be more comfortable if they are in their comfort zone, entertainment atmosphere, where they will not fear going to clinic and having this tension of seeing eye doctors with so many equipments and everything. So this is the area where they love to be, and that will make it easy for them to give awareness.
Yes.
And the second is that the avenues itself has huge traffic at weekends.
Yes.
We are talking about 300,000 people at weekends visiting avenues, and that gives us a lot of opportunity to see as many kids and parents at the same time. And so this is the 2 reasons why we chose avenues.
It's actually a beautiful place, Avenues. As you mentioned, Mr. Ali, it is a huge and has a lot of people there, especially children. They're going there to play.
Yes.
So you are trying to attract as much as you
Yes.
can from
Yes.
children and parents.
Yes.
That's really
And
lovely.
children and parents and a population more than 300,000 in the weekends. So Dr. Manal, this is like we call it success because you have been already there and you checked more than 700 person with their eye checked, you and all your colleagues. So I know it's a question, but how do you see the demand in the exhibition? How people react with you? Tell me about your experience. You love people, I know.
Absolutely, absolutely. So, well, basically, let me just share with you some of the wonderful moments I had. You would had, we actually saw a 3 years old, coming.
3 years old.
3 years old, coming running. I mean, we were not distributing, toys or anything that would catch their eyes. But they see that this is a friendly, open atmosphere where everybody is smiling, laughing, talking to them, going down, to their eye level, talking to their parents, talking to them, not wearing white coats.
Spontaneous
exactly,
talking.
not having even, the smell of a hospital or a clinic, or, all
Yes.
those, indirect, sensory messages send, an environment of discomfort or comfort to the children. So it was a wonderful open experience. This is actually not the first experience. Over the past 13 years, we've been doing similar campaigns. I've initiated a program called Shoof Zain back in 2010, being sponsored. Shoof Zain. Shoof Zain. Have a perfect vision or perfect
Yes.
eyesight. So Shoof Zain. And basically that was because our main partner at that time between the Ministry of Health, Kuwait University, was Zain Telecommunication.
So too many sectors together.
Exactly, and we went, to schools. We screened children in schools. We've been to malls. If you do remember, Goat Market. Whenever there are gatherings for, embassies, we were invited. So basically, this is a success. I'm blessed to have been introduced to new colleagues in different sectors, non-for-profit, optical shops like the International Optics. It is such an wonderful opportunity to thank them, to tell them that we appreciate your social responsibility programs that helped us to achieve this success that we are sharing with the community.
And also we appreciate your efforts for you doing something
Exactly.
for the community, Sarah.
Exactly. As you saw, Dr. Manal, as an academic staff member in Kuwait
Yes.
University, did you have any research in population eye health?
Absolutely, we did. Actually, my research started years ago. during my high school years,
Yes.
even before becoming an ophthalmologist and an academic staff member, we had a strategic plan designed specifically for Kuwait. This is an academic collaborative research between international organizations, professional bodies, experts in the field, and it basically provided a 5-year strategic plan to develop ophthalmic care in the country.
Yes.
For all ages, all sectors. Basically, it had a 1-year action plan. We were hoping that through preventive programs specifically designed for children, for adults, for the elderly, targeting diseases.
Can you show us?
Targeting diseases.
Like this better, yes.
So basically, this is a strategic plan.
Yes.
And that was one of the main contribution of the academic sector in Kuwait University, where we thought that, you know what, vision and visual problems can be prevented.
Yes.
So rather than focusing, and this is the mission of iZone as well, rather than focusing on treatment, waiting for the problem to happen, and then try to find, a solution for it or a treatment for it, let's start from prevention.
Exactly.
And there are screening programs where you can screen children, where you can screen people who are at risk because of a specific exposure, like using, monitors and, screens and tablets.
Nice.
So there are programs that target prevention rather than cure in every sector and every age.
Nice. So this is like you already mentioned about our guest, Ali, about the iZone. So talk more about what we call it, about your participation in the event. So is like this event, participation helps you a lot as a person, as your colleague, as a community entities?
Yes, in fact, our magazine's mission, iZone, is to spread awareness and also contribute with statistics, researches, and where there is information, data, and statistics, it helps a lot, not only for us to publish it, but also to share it with decision makers to perhaps develop the healthcare systems according to the statistics. We are so happy about this campaign that we brought up these numbers, and of course there will be more analytical information about this data. So the age, the genders is very important for decision makers to develop a very good eye healthcare system in Kuwait.
And there is something else, my guest. I know you have been working for a very long time, every one of you. So this couple of years, you are working together, collaborating, doing everything together, and more than 700 person already checked that time, and you are arranging your magazines also. Yes. So what gonna be for your next article?
You see, this is going to be overwhelming for us to put this statistics in the magazine and also spread it. There are also organizations outside Kuwait willing to know more about this campaign. And there was a challenge for us that they said we couldn't do it in many countries. Can you do it in Kuwait? So we said yes, we are going to challenge ourselves. And with help of Dr. Manal, she's humble about it, but I want to say something that she was very inspiring for us to lead this campaign to what we reached so far. Yes. She added a lot of her knowledge and a lot of her inspirations to the kids, to the staff, to the members who contributed with us. She was there always from morning till evening. Nice. I really like to thank her here.
And I would like to thank both of you because I am proud of you and all the people who are participating in the campaign, Sarah.
For sure, Aziz. And Doctor, as a faculty member in the university, so what advice you would like to give to your students especially?
Yes.
They are using a lot of devices, as you mentioned.
Oh, yes.
So how can we protect their eyesight, actually?
Okay, this is an advice to everybody, not only my students, including yourselves, Aziz and Sarah.
I will keep my...
Please do. Yeah. There is a very simple rule that we use. We say 20, 20, 20. So remember this, okay?
Okay.
Some people might not thank me for this. So for every 20 minutes, you are working using a tablet or a monitor or an iPad or a screen without a filter. please, please, please take 20 seconds away from the screen. Even, if you cannot move away, just close your eyes for 20 seconds. Okay. So for every 20 minutes, work on a tablet or an iPad or a computer screen, especially those without a filter. Please take some time, close your eyes or go away for 20 seconds and look at something that is 20 feet away, or roughly 6 meters. And 6 meters is basically, the human arm, from the tip of your fingers maybe to the tip of your nose is nearly 1 meter. So if you would imagine 6 meters, so try every 20 minutes to take 20 seconds, look at a 20 feet away target or object.
Nice.
So this is basically, a general advice, to keep your eyes safe, especially at the time when we are all using monitors and iPads and computers and all that.
It's really a golden advice, 20-20-20. Remember
That's right.
it.
20-20-20 for my health and safety.
Exactly, and it's called actually Vision 2020. When somebody's eyesight is perfect, we say they have a 6-6 vision or a 20-20 vision.
True.
So again, this is another, rule.
Amazing rule, Sarah. Yeah. So we have to already applying it.
Yes.
I already keep it in my mind.
Exactly, me too. So thank you so much, Dr. Manal, for this golden advice, actually.
I appreciate it.
So, Mr. Ali, from your experience, actually, what age actually requires more attention towards their vision?
Yes, for us, all ages, but mainly and primarily kids, to prevent them from having more difficult time with their eyes in future. So kids are really priority for us. Elderly people who wants to live independently and live their life without any hassle, yes, and be, practicing their life at that age is also because they are vulnerable people. Again, young people who missed the early detection, early prevention, we also take care of them. But kids for us are the future, and we want to really focus mainly on kids at this time. That doesn't mean that we will also forget about the other ages. However, kids for us, as early as possible, they should test their eyes every 6 months until they are 18.
Yes.
So that is a must, and we shouldn't stop checking their eyes regularly, even if they are good at this age. After 6 months, after 1 year, they have to keep testing their eyes until they are 18, when the vision is more stable at that time.
Nice.
So it is a must.
It's a must to be the best. In the beginning, Dr. Manal, you mentioned something important. It catch my eyes, even I'm talking now in the eyes examples.
Sure.
Volunteers.
Oh, yes.
People working with you. Eye Zone. Even you are a representative of the Kuwait University and the Ministry of Health. Yes. Tell me about the volunteers who are working for these all the days for the campaigns. You mentioned them before your name, by the way.
Oh, absolutely, absolutely, and they deserve to be recognized. Nothing like what we did over the in the Avenues event and previous campaigns would have led to anything without the support, the actual contribution, the very valuable contribution of volunteers. When you have somebody genuinely donating their time and effort and sometimes money.
With their smile also.
Exactly. And they are there, not complaining, 12 hours. I had, a couple of medical students who were with me over 3 days. I had a young trainee, and I would love to thank them. Al-Hanouf, Noura, and Abdurrahman, they donated their time. They came, they were there, smiling. Nobody is paying them. Nobody is going to give them any grades or anything for this. They did this out of the goodwill
from their heart,
of their hearts. Absolutely. Yes. Equally, we had volunteers, for example, from International Optics. Those optometrists were there examining in and out 6 to 7 hours as a one go. It's
like a working time.
Absolutely, absolutely. So nothing would happen without this amazing voluntary contribution. Saying that, basically, we have again to recognize the Ministry of Health, for basically making sure that this event would happen. Their approval, their presence. Dr. Abdullah Al-Baghli, the head of ophthalmic services at Al Bahar Eye Center in the Ministry of Health, was there with his support and advice, from the beginning. Nice. Our collaborators, our sponsors, their representatives were there. Their volunteers as well. We had representatives from Zain Fund Team
And there is also something else. We're like, on behalf of us, our show, Good Morning Kuwait, we're sending our gratitude for the Ministry of Health for what they are doing for the sake for the campaign, Sarah.
Exactly, and also we are sending our greetings to all the volunteers. Actually, it's really a noble work to do, the volunteering. And now we are talking here of like 12 hours of volunteering to save and protect children's eyes, which is really a great message.
Absolutely.
And also, Mr. Ali, about iZone. Yes. I know you participate, and I know you're thinking you're writing a new article from now. Manal is here. You have to give me something exclusive for Kuwait TV, okay? Yes. So as you and your participation there, and all the people coming to you, people know about an iZone, about something about technology, something about magazine. But I know your participation is more than that. Tell me, Mr. Ali.
You see, for iZone, it's a message from beginning. The reason why we established iZone is to spread awareness. And this was the best time for us, where we were looking for it. Of course, we have so many programs in future, but this one really hit the target, which we wanted to do it since years. And we're so proud that not only we made this happen, but we came to know people like Dr. Manal, who added many things to us, and now we are not only one in this. We are together, and that gave a lot of value to what we are doing.
Nice.
Yes.
So all about awareness and even giving a true value for everything they are working for, Sarah.
Exactly. So we heard Dr. Manal advice about how we can protect our eyesight. What about you, Mr. Ali? Do you have any advice?
You see, Dr. Manal covered most of the requirements. However, we also say that when you come to use your eyes, you just need to know it's not only the digital devices. Yes. It's whatever you do using excessively your eyes, whether you are reading a book, again you need to rest your eyes. Whether you are doing something close work, because especially close works are really very hard on the eyes, muscles and everything. So we think that the advice is always make sure that your eyes is priority for everything in your life. Yes. We think that 80% of body function depends on the eye.
Absolutely.
So if you take it that serious, whether you are, a kid or adult or elderly people, you will be always living in safe about eyes, because once it happens, it's very hard to recover it again.
Nice.
So as Dr. Manal was mentioning, prevention is the best way to do it.
The best way to cure.
Absolutely.
Right, Sarah?
Right, actually, Aziz. So we are appreciate actually all your efforts and all this campaign you did in the Avenues Mall, and I wish you all the best of luck. And we are so happy actually to have you with us this morning.
Well, thank you very much for having us, and thank you very much for the opportunity to share some of the advices that we have for all sectors in the community, whether you are a child, an adult, an elderly, somebody working outdoors or indoors. Please, please, please take care of your eyes.
Thank you, and also special thanks to you, Mr. Ali. Have you want to say something on this? Okay, on this.
Thank
interview?
you. I just like to add something which is very important, that you guys were also initiative in covering this event and having us today. This adds a lot of value to this campaign also. Yes. Thank you so much.
And thank you so much. This is our duty, because Kuwait TV always they are doing the shedding the light about what's happening in the state of Kuwait, especially people who's working heart by heart, hand by hand, for the sake, for the safety. Thanks a lot. Sarah, we say good times run very fast.
Exactly. So big thanks to Dr. Manal. She's a consultant ophthalmologist, assistant professor and the Faculty of Medicine, and also Mr. Ali Banddor. He's a founder and CEO of iZone. So protect your eyes, dear viewers. And now, dear viewers, we have a little tiny shorter break, and we'll come back again.